Compassionate care beyond measure. To champion access to compassionate, high-quality care by remaining independent, strategically comprehensive, and community-focused.
Make every interaction meaningful. Act with the servant's heart. Our culture is something that we grow through actions, not words. Let's be intentional in our actions to serve those around us. We make it a point to say hello, know patients and colleagues by name, and ask how they're doing. This is the Baxter difference.
When I think of those core values, make every interaction meaningful, my mind goes directly to Sonia Gower. The first sentence of the value is, act with a servant's heart. Sonia truly has that servant's heart. From her desk of serving the nursing administration, she always is an example of that caring spirit. As I walk by her desk daily, she always speaks with a smile, asks, how are you doing? And can I help you? During the days of COVID, she left her safe environment in administration and went to the COVID floor and sat with the COVID patients, holding their hands, massaging their foreheads, wiping their tears, and whispering words of peace and encouragement. This truly is the Baxter difference.
Be extraordinary every day. We're always on the lookout for opportunities to be exceptionally unique, authentic, and uncommon with our actions. When we engage fully. When we act with intention. Everything we do wholeheartedly. Our extraordinary efforts leave patients and families with memories they'll cherish forever.
Many people at Baxter Regional come to mind when I think about individuals being extraordinary every day. The Baxter Regional Social Work team does extraordinary work daily to support and serve our patients. More specifically, Susan Carr is extraordinary in the eyes of the newborns, elderly patients, patients in challenging situations, and the underserved population receiving care at Baxter Regional. Susan authentically lives her personal values every day, always respectful, never judging individuals, and always trying to improve the environment of the patients. She believes her role is to serve. Even in difficult situations, Susan never abandons the patients and always takes the final step or makes the final call to ensure the solution is solid. She is the OB queen of social work and handles complicated adoptions with grace. Susan is an advocate for newborns or families in working through the legal processes. She passionately cares for not only her family, but also her work family and friends. Susan always goes above and beyond for all of our patients, no matter the circumstances.
Always take ownership. While compassion and excellence are the heart and soul of our organization, pride is the backbone. Every day, we live up to our magnet status and stellar reputation by putting the Baxter difference into action. We lend a hand when help is needed. We show leadership in times of uncertainty. We make patients, colleagues, and communities better simply by being Baxter.
To excel in taking ownership, there is one specific nurse that comes to mind that is extraordinary while representing this value, Matt Gregory. Not only does he charge and take a load of patients, he also is the vascular access nurse for nights for the entire hospital. This past year, he put in a total of 496 lines. He seems to know which unit is struggling the most and just showing up to offer help. It does not matter if he is cleaning rooms, doing vital signs, helping with admissions, or giving baths. He will do whatever it takes to care for our patients. There are countless examples of how he has helped not only other nursing units, but lab, respiratory therapy, and housekeeping as well. One would think the staff on 4 South might feel frustrated as their charge nurse is offering them up to help, but they don't. He makes them feel good about their work on 4 South and the entire hospital. He also works many extra nights through the week to help out. Leading by example, Matt inspires hope when people are ready to give up, facing every night with "we can do it" instead of "we can't do it," and never tooting his own horn nor complaining. We never hear from him on the weekend, as he is busy ensuring that all our patients are cared for, not just the ones on his unit.
Provide service beyond measure. We use every moment as an opportunity to leave an indelible mark on our patients and each other. It's our promise to one another to faithfully seek out new knowledge and perspectives that challenge our embedded views on health and wellness. Only by embracing these experiences, and sometimes setbacks, can we arrive at a deeper level of understanding and more informed relationships with our patients.
When I think of service beyond measure, I think of Carol Milne. Carol's a food service employee who most days can be found in the physician's dining room. She greets everyone who comes in by name, knows what they like, asks about their vacation, overall pays attention to everyone. I fix extra salads, soup, sandwiches every day. I leave them in the refrigerator. I also take care of the surgery center. Okay, and so they all do get eaten. So she is both cutting down on waste, making sure people who are missing meals has a chance to get something to eat. Also, since it's only soup, salad, sandwiches, and snacks, she goes out of her way to get different items from week to week so it doesn't get monotonous. Overall, Carol just takes care of all of us like we are family.
Comprehensive care by design. We aren't just one hospital, but a family of interconnected healthcare facilities and providers that offer head-to-toe compassionate care. For every patient who walks through our doors, we have a doctor or specialist who's prepared to win trust, treat illness, and deliver them back to ordinary life. Treatment could start here and now, or a few counties over. At Baxter, where there's a diagnosis, there's a direction.
Comprehensive care by design is a value that very few rural hospitals exhibit effectively. Baxter Regional is one of those few rural hospitals that can not only pull it off, but model it seamlessly. With 27 clinics spread over a large web of surrounding counties and over 80 employed providers, Baxter Regional has both the primary care and the specialty care to handle almost any patient situation. One provider whom recently joined our team has demonstrated a unique skill set not only to excel in grassroots patient care, but also to see the big picture of interconnectedness of the different specialties, hospital services, and primary care. This provider has served on critical planning committees for improvement of patient care and has thought strategically on how we can help new programs and services to meet patients where they're at. So this provider works in our cardiovascular clinic and has become an integral part of our leadership team for her unique insights and passion for improving patient care. Most importantly, she understands how it all connects between the different specialties, hospital services, and home environment. That employee's name is Leah Fountain, and her impact since the acquisition of Cardiovascular Associates has been invaluable. We're blessed to have her on our team. Mr. Bill Baldwin. Well, that was just not expected at all. Oh my goodness.
Independent with a purpose. Because we are independently operated, we are able to act quickly, decisively, and in the best interest of our staff, patients, and surrounding community. Less red tape, more open doors, no unnecessary corporate mandates, only compassionate care. Trust and transparency is simply how we operate, in good faith and for the greater good of our Baxter family.
When the COVID surge arrived at Baxter Regional, we had baby monitors outside the rooms to visualize the patients. The nurses were struggling to see the patients through these monitors as they were very small. You could not visualize the patients in a way that made the nurses feel secure about the patient's status.
Dale White, Michelle Piersky, and James Dabney met with Biomed and vendor and arranged to have cameras and monitor equipment placed in all COVID rooms. This was done very quickly, and the nurses were better able to monitor these patients. They also installed the central monitoring station so the patients could be visualized from a big screen at the nurses' station.
They were able to see their oxygen levels as well as their heart rate. Dale and James also made sure the COVID nurses were fed day and night so they didn't have to worry about leaving the unit. These interventions are examples of our value, independent with a purpose. do the right thing for our patients and nurses in the moment.
Think as many, act as one. We share a common purpose to significantly affect every life we touch in a meaningful and positive way. Our ability to sustain this impact is derived from our commitment to working in the same direction as one. Though we're each accountable for our own responsibilities, each of us must recognize our role in reliance on each other in achieving operational excellence. Through this interdependence, we'll not only work harder, but we'll also work smarter.
To me, no other project that I have been personally involved in has epitomized this value. The idea of each of us being accountable for doing our part to making the whole successful as starting the outpatient surgery center. When we opened, we thought it would be a slow start and we would do 4 to 5 cases a day. Some days it was like that, but some days it was more like 15, right from the start. Every time we asked for help, it was freely given by already busy people because they were all committed to one idea: taking care of our patients in the outpatient surgery center. Surgery shared staff, materials delivered things daily, medical records helped by starting to pick up records, food service started delivering food, and everyone at the surgery center wore a path out to the hospital getting supplies and equipment. But pharmacy really stands out, especially Doris Brandon and Logan Barnes. I'm flattered. With the support of their leader, Ryan Killian.
When we opened, we had 2 med machines that we borrowed from other places because ours weren't in yet. We needed 7. Doris, Logan, and Ryan walked to the pharmacy center every morning before surgery started to bring med trays so we could start the day. They worked with our doctors to change the meds we stocked in order to maximize our space. And still some days they would come down multiple times a day with medications for us. Doris even made sure we had her cell phone number for urgent issues, rain, sleet, or snow. They were there for us.
Treat everyone like family. We are a huge part of the communities we serve, and likewise, they are a huge part of us. Therefore, it's critical that we remain community-minded in all that we do. Whoever needs our care, be they a neighbor, old friend, or someone just passing through town, let's treat them like family, providing compassionate care that feels like home.
Recently, my father passed away in ICU. As any patient who has been on the ventilator and due to the acuteness of his illness, by the time he had passed, he certainly didn't look like my dad. And common practice when someone passes away who's hooked up to a lot of things, the family's asked to step out of the room as the staff, the nurses and the staff remove the hoses and the tubes and clean them up so that the family can come back in and spend their final moments. And that was done for my family. But when we got back in the room, like I said, my dad didn't look like my dad when he passed. And a nurse, Eric Hicks, here in ICU, took the time as they were cleaning up my dad to wash his hair and to dry it and comb it and shave his face and presented him in such a way that it brought tears to my mom's eyes when she walked in the room. When we all walked back in the room, she whispered over as she grabbed his hand to my brother and sister and I and said, "He looks like Daddy." And to do something like that, not only for my family, but for every family that comes into our ICU and maybe loses their loved one. Baxter Regional is an extraordinary place because of the people and the extra time they take to make sure that not only the patient is tended to the best we can offer, but also the families, so that they know that they're appreciated and that we value them. And my mom will never forget that.